The holiday season is underway, and this time of year can be stressful on people. But there's a new mental health service that's helping everyone in Milwaukee County find easy and accessible resources. I'm here with the president of Impact, John Hyatt, and the director of Milwaukee County Behavioral Health Services, Jennifer Whitwer. Thank you both for being on today. We're excited to talk about this new program and tool. So, John, can you kind of talk about what is sort of the status of mental health in our community, and how can this new tool help people?
Yeah, sure. So like most communities, the incidence of mental health and substance use is at historic levels, exacerbated by the pandemic. Mm-hmm. What's different now, through a lot of awareness raising, is that people are more aware of mental health, and the issue has become more normalized, mm-hmm. and so it's easier to talk about it. So somebody can say, you know, I'm really stressed out, I'm anxious, I'm depressed, and it's okay to talk about that now, more so than it had been in the past. So as we've had increased requests for help, we joined the campaign to help make getting to resources easier.
Yeah, and Jennifer, can you touch on what sort of this new Navigator tool is and how it is helping people out?
Yeah, absolutely. So it's been exciting to be part of this, and we've been working on it for some period of months now, but it's really been a joint partnership between the public system, that being Milwaukee County. I'm from Behavioral Health Services, part of the Department of Health and Human Services, but then also all of our members of the Milwaukee Healthcare Partnership. So that's going to be our large hospital systems, our federally qualified health centers, and to be able to come together and recognize that, like you said, a lot of people are needing help, but also we have a lot of resources and people don't necessarily know that. The hard part is navigating the resources. Mm-hmm. And so we really wanted to come together, first and foremost, in partnership with our partners at Impact 211 to make sure that our inventory of the resources is accurate. And then thereafter, helping people have simple, easy-to-use tools to navigate those resources, and that's where this project really came in.
And so this is sort of all just compiled into one place, right, on a website that people can access them?
Yes, that is correct. So we really wanted everything, like I said, to be easy to navigate and to have that one centralized point that people can always turn to be their so-called source of truth. Mm-hmm. And so that website is www.healthymke.com/well. And I would encourage anybody to go there, whether you're looking for help for your own mental health or addiction, if you're helping a loved one or someone you care about, look for services for their mental health or addiction. There's going to be resources there for you that are going to very easily depict the various different ways that you can start to navigate those resources. Conversely, if you're a provider working in a helping role, there's a separate set of resources for you there as well.
Awesome. And obviously 988 is something that's there if people need immediate assistance, but this is a great way if you kind of want to find out a bunch of different tools that people can use.
Absolutely.
Thank you both for being with us today. We really appreciate it. Again, the resources, they are live right now for anyone who needs them or would like to learn more. We have a link to them on our website and mobile app. Just click on the links tab.